People around the world are in need of plastic surgeons. There are a lot to choose from, but how do you know that you can trust yours? Wake News health expert Dr. Michael Kim is joining us live in the studio to give us some advice and to let us know all the training that goes into actually being a plastic surgeon. Thank you for being here. There's a big difference between a cosmetic surgeon and a plastic surgeon.
Yes, a cosmetic surgeon basically says a surgeon that does cosmetic surgery. It could be your family practice doctor, it could be a gynecologist, it could be anyone. A board-certified plastic surgeon has to go through specific training recognized by, as you can see here, there's two pathways. There were only 135 spots last year, so only 135 plastic surgeons graduated last year, as opposed to, for example, 6,500 internal medicine doctors. So there are not a lot of plastic surgeons out there that are board-certified. The total training is anywhere from 6 to 10 years. In the old days, when I trained 20 years ago, I spent 10 years in training.
Wow.
So we're probably overqualified for a lot of things we do. If we can go to the next slide. The problem is with the decreased reimbursement with insurance, a lot of these specialties started wanting to do cosmetic surgery. So they made up these boards, such as the American Board of Cosmetic Surgery, the American Board of Liposuction Surgery, various ones that basically are a bunch of physicians that came up and made a board, but it's not recognized by the American Board of Medical Specialties. The ABMS is the board that overlooks all the subspecialties, gives the examinations and the certifications, for example, pediatrics, internal medicine, plastic surgery. So you want to make sure that your surgeon is board certified by a board recognized by these ABMS. And so that is very confusing when you go to a doctor and he says, I'm a board certified cosmetic surgeon. That really doesn't say a lot about your training. It just says that you want to do cosmetic surgery. So you have to make sure it's board certified in plastic surgery.
So how exactly then are they allowed to do surgery? I would assume that they don't have hospital privileges?
Well, sometimes they can scoot around it. A lot of procedures in the office, the state of Florida says that you can do pretty much anything with a medical license in your office. So smaller procedures, anyone, you're seeing, gynecologists, family doctors doing facelifts, tummy tucks, liposuction. It's kind of, and general surgeons. But unfortunately, a lot of patients are not very well educated, and they see board certified in cosmetic surgery, and they assume that physician's okay, and hopefully they'll have a good sequelae. But you hear a lot of nightmares about these patients. So I really would say that you really have to do your research. You have to word of mouth. Friends have had it done. You can go to the ABMS site. I think it's on one of those slides where you can actually look up and see if your physician is board certified. I think on the you also want to make sure that their physician has privileges to do whatever you're having done in the hospital, which says a lot. Because if they have privileges in the hospital, then it means they're probably okay. And also, it should be performed in a very safe environment.
Okay. Thank you so much, Dr. Kim. We'll have more information on our website, wakenews.com. You're watching Wake News This Morning on WXCW.